Question 17. You have been caring for an elderly lady for several weeks. She is getting better, but will need to stay in hospital for a few more days. Her husband asks to see you. He thanks you for looking after his wife and insists that he would like to give you a large bouquet of flowers and a bottle of champagne. Rank in order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Accept the gift and tell him that you are so grateful that from now on you will take extra special care of his wife. B. Accept the gift and resolve to put in the flower in patient's waiting room and give the champagne to charity to not feel as if you have benefited. C. Decline the gift and explain that you don't like champagne. D. Explain that a gift is not necessary, but thank him and accept the gift. E. Thank the patient, but decline the gift, and explain that staff are unable to accept gifts from patients or their family. Answer: D, B, E, C, A. The issue of doctors. Accepting gifts from patients is a difficult one and often dependent on the nature of the gift. Intimate gifts, such as lingerie, are clearly inappropriate. Cash gifts are generally viewed as unacceptable, and expensive gifts should either be declined or registered with your employer. Expense is dependent on the patient's means. Although gifts worth in excess of £100 should usually be declined or declared. Whatever the circumstances, the receipt of a gift should not be seen to affect a patient's treatment. Option A is therefore the least appropriate response. Declining gifts can also be problematic, as it may cause offense. The most appropriate response is therefore option D, since it is clear that the gift does not affect the care of the patient, but it shows gratitude. While option B avoids causing offense, the gifts were not offered with the intention that you should give them away. Option E may be appropriate, although it has the potential to cause unnecessary disappointment or offense. In the case of option C, it would be rude to decline the gift based on your dislike of champagne. Question 18. You have only been working as an FY1 for a few days? One of your new FY1 colleagues comments to you that they have seen your profile on a social media website. They mention that many of your recent photographs picture you appearing extremely drunk, including some in which you are dancing on a table. They suggest that you remove the pictures as they feel that it is inappropriate for a doctor to be seen behaving in this way. Rank in order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Delete your social media profile completely and resolve not to use social media. B. Ignore your colleague advice, but delete all your colleagues from your friends list to prevent a similar situation in the future. C. Leave all your photographs on your profile, but ensure that only your friends, rather than the public, can view your profile. D. Remove all compromising photographs from your profile and ensure that only your friends, rather than the public, can view your profile. E. Tell the colleague to mind their own business and ignore their advice. Answer: D, C, A, B, E doctors are entitled to a personal life. However, they must maintain a level of professionalism. The currently accepted standards are ill-defined, but the public needs to have confidence in both the individual and the profession. Doctors should consider that content uploaded onto social media may influence public confidence. In this scenario, it would be prudent to remove potentially damaging images from social media websites, and doctors are encouraged to review their privacy settings regularly. Option D is therefore the best response, altering your privacy settings without removing the images. C leaves the potential for your images to be viewed by people who may be adversely influenced, given that social media websites cannot guarantee complete privacy. While refraining from the use of social media, A would remove all risk to professional image, you should be allowed to take advantage of its benefits should you wish to. This is therefore a valid but less favorable solution. Options B and E may damage working relationships with your colleagues, and neither addresses the issue of professionalism